Thank you everyone for joining us, and we apologize for being a few minutes late. Technical difficulties. You gotta love technology. Never works when you actually need it to. Good times, but we have everything figured out now. So I am joined by industry expert Chad Hendricks and then Maria Fortes from our team. If you guys want to say hi and introduce yourselves.
Chad, you want to go first? Okay, I'll go first. Hi, everyone. As you know, I'm Maria Fortes. This is our third in the series of From the Ground Up. Very excited to be here. I've been in the dental space for over 20 plus years. Began my career actually managing de novos, focusing on scalability, and I'm the director of the Practice Heroes program here at CareStack, and I'm happy to be part of this very important discussion. Actually, this is a question that's always asked about us with respect to insurances. Lots of questions about insurances. So glad to have Chad Hendricks here.
Yeah, thanks, Maria and Nicole. Chad Hendricks here. I'm the owner of Clear Choice Consulting, consulting company I've owned and operated for about 2.5 years now, but 16 years before that. So a total of 18, 19 years I've been working in the dental area, working with large dental groups mostly. But the last couple of years been working with a lot of solo offices and small groups to support them in all their insurance needs. So a lot of years of experience working with insurance companies and trying to share and pass on that knowledge to others.
Thanks for that, Chad. Okay, so let's go ahead and move forward with this important conversation. Basically, I know it's that time of the year as well, where people are, employer groups are negotiating new plans with insurances, and obviously insurance is a hot topic. So let's go with what we're going to be talking about today.
Yeah, that sounds great. And as you said, insurance is sometimes a frustrating topic. Makes people angry, makes people scared, makes people confused. I see all of those things all the time. And even if you have many years of experience working with insurance companies, it's very, I like to think I'm pretty much an expert, but I'm really not, because things are always changing. So you're never going to be on top of the mountain with these guys, the insurance companies. They're always changing things, and there's new companies or acquisitions and things. So it's a common challenge that people have. So you're not alone if you have questions about insurance. I mean, large groups hire dozens of people to try to manage this for them. So this, even small groups, they typically don't have a lot of resources to do that. So it's important to get help and ask questions. So happy to be here and talking about insurance and try to share some knowledge with, mainly our topic is de novos, right? And looking at opening a new office, whether it's your first office or whether it's an additional office, there's always challenges and questions. And we had 3 main topics I think we figured out, and that was, which plan should I accept? How do I go about contracting and negotiating with those plans? And then another scary word sometimes, credentialing, that a lot of people are afraid of and not sure what to do or how to do it. So that is kind of the third main topic we'll touch on today as well.
So plans to accept.
Yeah, so when you're opening a new practice, I mean, you're probably already working in the market, so you have an idea. But I think that's an important thing, is to know, like, what am I already contracted with? If I'm working with a group or another office and I'm opening up my own office, you may have a good idea of what plans to accept, what's out there. You may hear of a plan, but it may not exist in your market if some other colleague tells you about it. So it's important to know, what your market looks like. And there's 3 kinds of plans, really. Mainly PPOs, DHMOs, and Medicaid plans. We won't touch too much on Medicaid. That's a whole nother lecture, maybe a 2-hour one or 3-hour about Medicaid. That's right. A tricky one and challenging. But it also, there are offices that thrive with Medicaid, so doesn't have to be a scary word, but it is a scary word in some cases. And typically, when I look at a hierarchy, I do put them in the same order. PPOs are the top. Fee for service is the very top, right? No insurance. But we're in a world where insurance is very prevalent. I believe the statistics show, even with COVID, there's over 70% of people with insurance of some kind. So, whether that's government assistance or a PPO plan or a DHMO. So you've got your fee for service patients, you've got your PPO patients. The next tier is DHMO patients, the HMO plans, which are more prevalent in certain states with certain employers. And then you have your lowest, reimbursement with Medicaid, but it is a large a large amount of people in some markets have Medicaid, so you may need to consider that as well as the DHMO. But for the most part, I think we're going to talk about PPOs and looking at which PPO should I accept. And under
Actually, Chad, we
go
do
ahead.
have a question from Dr. Sharon, and
Yeah.
I think it's a perfect time to interject. I'm going to try to place these questions strategically throughout the conversation to make sure I'm not interrupting you or it doesn't make sense to add these questions in. But Dr. Sharon asked, how do I know which plans to accept, and should I accept umbrella or network plans?
Did she see the slides beforehand? She's segueing in nicely there with the next topic. I mean, that's great. So as it says on the screen here, direct contracts, should I do that, or should I use network umbrella plans? I think you can have a strategy, and this is the next kind of topic here, a strategy of both. I think when you really get into what plans to accept, you need to be looking at a couple things, and one of the main things is, are you joining a plan that's going to bring you patients? Do they have volume? That's important to know. As well as the big one that everyone's interested in is, what are the fees, right? So we want to know how much reimbursement. What am I going to get for a crown? What am I going to get for a cleaning? It's good to know that, which gets into, we don't need to jump ahead quite yet, but on the slides, but negotiating the rates with the fees. So it's important to know, where are the members in your market? Delta Dental's always got a lion's share of the market. So knowing that is important, but knowing what other plans are in the market. And then really going after, and one of our next topics is negotiating with the payers and talking to the payers about the fee schedules, right? Which again, perfect segue here. We put a little graph there up on on the market, and I've been touching on that, knowing the market, right? So you want to know where things are at, what plans are in your market, and again, as you're probably performing dentistry or working in that market, you probably know currently what's out there. But then, another topic is to handle, you can handle contracting and negotiating internally or externally. And really what that means is, internally means I'm going to do it myself as a doctor or as an office manager or whatnot, which is perfectly fine. And then externally is to use a third party. It's something I do or other vendors do, and try to assist offices with this, because we may know the markets, we may know the plans, and typically I do, for example, know the markets and know what plans you should be engaging with to have discussions on the fees and to know what kind of membership do they have and who do I work with. And these things are where that can be helpful to use a third party. But I think it's, oh, go ahead.
I'm sorry, Chad, but it's something that comes up all the time because we're talking about the market, knowing your market. I get asked all the time, like, how often should I, like, say a doctor would ask me, do I need, how often do I need to raise my UCR fees? And how do I know what everybody else in the market is charging, if you will?
That's a good one, Maria. We do get asked a lot.
Yeah.
Yeah, and really that, again, it's a nice topic to touch on in this conversation, because, before you want to go to the payers, you need to know your fees, right? You need to know, what am I going to be charging? So if you're opening up a new practice, you need to set your fees. I'm working with an office right now that's starting their same kind of scenario. They're working at a group practice. They're starting their own practice, and she engaged with me in the North Carolina market. And one of the first things we did was let's look at market data, which is something you can purchase on your own. Again, you can do it yourself, or you can use a third party like myself. And I have that data, and I can share that with you. What is the 80th percentile of that market, for example? And then you can know, okay, these are the average fees that dentists charge in that zip code. So again, it's very geographically based. And now you have a baseline. What are they, $1,200 for a crown? Is it $1,800 for a crown? Is it, what are the right rates to be charging? So then I can take those fees to the payers and the insurance companies, and then negotiate from those the discount levels that you may have. How much are they going to reimburse you? So it's important initially to do an analysis, whether, again, you do it yourself or with another party to help you to know what is the market charging, and then you set your fees at that level. I've worked with some offices that are, right in the name, they're calling themselves the affordable dental office or whatever. And maybe you want to be at the 60th percentile or the 50th percentile. That's you want to be a lower cost office, if you will. But that's an important factor, is to set those fees using market data, which you can purchase. A couple of sources out there. Fair Health is a company that's out there. You can go to CareStack.org, I believe, or you can go to the NDAS website, which also has market data you can purchase as well. And so you want to set those fees and get those where you want them to be, so you can go after, go and talk to the payers. And then to your other question, Maria, you mentioned how often should I update those? And I typically say update those annually. You should at least look at, you maybe don't have to purchase a full set of data again a year later, but you just have to know, you can do other searches with government websites and find out what is the cost of dental services, what have they gone up in the last year? And it'll tell you right on there, 2%, 5%, whatever. And then you can adjust your fees accordingly to keep up with the market. But it's important to be raising your rates on a regular basis, which again, most healthcare providers do, not just dentists, but your medical doctors and others. So you want to keep up with those costs, and we're dealing with it right now in the world, where inflation is hitting, 3-4% a year, or a month, excuse me, and it's important to be, raising your rates accordingly, because you're getting hit with costs on the back end.
I think that's where some of our clients and doctors out there, that they don't take into consideration that they will be hit with costs in the back end. And I think sometimes we get clients that are actually afraid to raise the fees because they're afraid that they won't get the patient base. Have you worked with clients of that nature, Chad?
Yeah. Good question. You don't want to, it's one of the things I talk about with my clients and the offices I work with and the doctors is you don't want to price yourself out of the market. I mean, we may look at an office and say, yeah, I raise my fees every year. I'm at like the 80th percentile, and we do the analysis and they're actually at like the 50th percentile. And so they want to be at the 80th percentile, but we look at it and go, well, that's a 22% increase. We don't want to do that. We don't want to scare away your patients. So basically what I like to do is build a step process where we step up the fees over a 3 or 5 year period. And we can take bigger jumps, and but anytime you get over, when you get to double digit increases is when I start to try to recommend that offices don't go too much higher than that, because patients will notice that. Patients do understand that healthcare costs go up every year, just like almost anything. So if your rates are flat for 5 straight years, you're being generous. You're not collecting what you should be collecting as a provider. So I again recommend you move up your rates at least with the cost of living increase every year. And you don't want to have sticker shock. You don't want to raise, last time I was in, your crown was 1,000, now it's 1,200. That's a big jump. That may scare away a patient, and they may call around and go elsewhere. So you just want to take those stepped approach.
It's a great approach. Thank you for that.
Yeah, good question. And again, that's a great baseline for this topic that we have on the screen here. The contracting and negotiating is you need to have your fees. A lot of carriers will ask you, what do you charge? And they have their own data that they pull, and will know what other dentists in the market charge to know what's a fair rate or what's a good rate or a poor rate. But you want to be able to go to them with what are your rates. And so you need to set those early, and then go to those carriers. So as I was talking before too, what carriers do I join? And even to the question that the doctor had, I say I like to engage as many carriers as you can, 20, 25 carriers. You may only join 5 or 6, but engage everyone, because you may find someone out there who's growing in the market and offering really great fee schedules. And that's what I find a lot of times is sometimes offices can get really sweetheart deals from a carrier because they're trying to build their network and they're growing their market share. So they want to give a really good rate. And other carriers, maybe, that are large in the market, they won't offer as much because they have more dentists. It's, it goes back to the old supply and demand, really. So if they have a lot of providers, they will probably offer you less, but maybe you have reason to demand more. So it's important to, again, engage the carriers. And that can be a tricky thing, because, what I find a lot of providers tell me is, I tried to do this and I called 1-800 insurance company and I got through a runaround of people and I can't get to the right person, or they get back to me in 5 weeks, and it's just quite a process. So working with a third party, can help you, because like myself, you have a lot of experience with these carriers. I know the carriers, I can email them directly. I'm working directly with people that can help you instead of a call center or some 800 number. So it can be challenging, but it can be done, and it shouldn't dissuade you from trying to reach out to carriers and understand the rates. But one key thing is don't just send in credentialing and just accept whatever they give you, because then you've really not negotiated at all, and they're just giving you their baseline rate for that market, really the lowest end of the market. So most carriers will negotiate, so you should be trying to negotiate with them and reach out to them.
Which I think, to be honest with you, I think a lot of providers don't know that, especially our startups. I
Yeah.
see that they just sign on the dotted line and accept the fees that are presented to them. And I tell them this, like, you can negotiate higher fees. And they think that I just, I'm going to accept this, I'm going to accept the fees that are presented before me, but that's not true. Right, Chad?
In many cases, again, there's a few that are out there that are difficult to work with, I'll say.
Right.
But I think the key element there is what I think about there is it becomes a time crunch, right? I'm opening my office in a month and I've got to get signed up with insurance plans. So I just go, and I just sign up with everything. And that's, again, the next bullet here says start discussions early because the payers take their time. You do you don't just want to accept whatever they offer you or not even offer you. They just sign you up. You need to ideally have some time. And I like to say 90 days is a nice amount of time to at least have a chance to negotiate. Some carriers will take longer than that in some cases, but that's mostly with renegotiations. But if you sign up, the thing you want to watch out for, and again, this is a good, I would say write this down, is if you sign up with a carrier and you start up your practice and you sign up with carrier A, you may now be locked in with them for 2 years and not be able to renegotiate. So you may say, hey, let's just get signed up with everybody and we'll negotiate in a couple months. You may not be able to because some carriers will basically say, no, you've signed and you're locked in for 2 years. So it's important to have that negotiation again early, get that discussion going at least 3 months early if you can, and get the fees set that you agree to. It's a two-way street there, not just them giving you the fees. You want to be able to accept those. So if you're talking to 20 carriers, you can then pick and choose the ones you want to accept. And you may be, again, a little handcuffed because, oh, I got to take this plan A and B because they're the biggest ones in the market. It's where all the patients are coming from. And so, that may hold you back a little bit, but it's just important to have those discussions and not just sign up for everything. So you're not locked in because some don't allow renegotiations for 1 year. Many are 2 years, some are even 3 years. So it's important to just be aware of that as you sign up for plans. Yeah. And now, one of the other topics, which I don't know if we don't have a slide specifically on, we could have a whole slide on it, that came up earlier, is the whole umbrella plan question, right? The networks. Right. It's called, I hear networks, I hear umbrella plans, and they're all really the same thing. It's your plans like, and I don't mind saying the names, Dentamax and Connection Dental and Carrington. These are all plans that are umbrella plans. And what that really means is they have a whole list of partner plans that work with them. They may have a small administrative group that doesn't have their own insurance, and then they work with Dentamax, and then the Dentamax network will prevail. But there are also partnerships with insurance companies like, United Healthcare, Humana, Aetna. They all have partnerships with these umbrella plans too. So you may say, oh, hey, I can join umbrella plan A, Dentamax, and then I don't have to join Aetna and Humana and these other plans directly. And typically, your umbrella plans will typically have higher rates than your straight, contracting with the insurance plan. So that's the advantage of going through an umbrella plan. You can typically get a little higher rates. There's many more disadvantages to it though too, and as long as you're aware of it and you're okay with it, it's not a bad strategy to go with an umbrella plan. Just again, some of those challenges would be, since you're not direct with them, if you have a challenge with one of those, since you're not direct with all the carriers, when you have a Humana claim issue, you have to go through Dentamax to get that solved, right? So now you're not going to Humana. They're like, we don't have a contract with you. You're contracted with Dentamax. And so you have to kind of go through a third party because that's the nature of it. So there's challenges with just dealing with that. There's slowness with things where I credential with Dentamax. Again, use them as an example. They're all the same in that regard. I credential with Dentamax. It takes them their time to credential. And then now they have to send the file off to all these third parties. And that takes another 30 to 60 days for them to open up, to show you in network. And so that slows down the process as well. And that can be a challenge, again, for the slowness of having, responses and credentialing. The other big challenge with third parties, I call them third parties as well, is working with umbrella plans and networks, is that you don't always get full access to these networks. You may say, hey, I'll join Carrington and I don't have to join Humana. I can see all the Humana's on their list, and Aetna's on their list, and Cigna's on their list, and I can see all these patients through their umbrella. And the fact is that's not 100% true. Humana patients will not all go through the Carrington network. Aetna patients will not all go through the Carrington network, or Dentamax, or whoever, if that makes sense. So a lot of these large insurance companies, the Aetnas and UHCs and MetLife's, they do partner with these umbrella plans, but they only allow a certain number of members to go into those. And sometimes if the employer bought that option, the employer can say, basically they're creating their benefit plan, and they may say, well, we want to have full access, so they can see all patients through these third-party arrangements as well. But a lot of employers choose a cheaper option, and that only allows direct contracts. So only directly contracted Aetna patients would be able to go into that office, right? So that's the challenge. And so you say, oh, the listing on Dentamax says Aetna, or your Carrington's list says Aetna, but not all the Aetna patients come through, and why are some in and some are out? So that's the challenge, is that in some markets you can see only 10% of the patients, 50% of the patients are coming through that leased third-party network. So I don't know if that made any sense to you guys on the.
Yeah, it kind of does. So obviously it sounds to me that we need to start credentialing ourselves in 90 days ahead of time. Prior to that, I would start looking into, so prior to the credentialing, right, is to start looking into these insurance plans, whether it's bundled or individual insurance companies, if you will, and starting to find out, okay, which one pays the most, and knowing the fact that I can negotiate higher fees.
Yep.
Now, with respect to the bundle plans, because there are a few out there, you've named several, I could also name several as well.
Yep.
Is there something that a provider would look at in a fine dotted line, like say, okay, Chad, I'm ready to go and sign up for a bundle plan. I've got 4 in front of me. And is there anything on this piece of paper that I should be looking out for?
Yeah, so if you were, well, one thing I would say, and I see this with offices too, is they sign up for multiple bundled plans.
Yes.
And bundle is, in other words, synonymous with networks or umbrella plans. So just not to confuse people. But they're in again, Carrington, they're in Dentamax, they're in Zealous. There's another one, Maverist. They're in, and so they're in all of these plans. And then they wonder, about what, and a lot of these plans that I just cited have the same lists of partnerships, right? So I can see Aetna patients through all of those guys, for example. And so the challenge becomes now, what'll happen is the insurance companies are getting smart. So if I'm in 4 bundled plans, they actually Aetna will go into their system and go, oh, this doctor is not in network with me directly, but let's see which partners he's in network with. And they'll go, oh, he's in A, B, and C, and D. And now they will actually look at the fees and will pay you on the lowest of the 4. And so that is a new strategy that insurances are starting to use, because doctors are starting to get savvy with these bundled plans and starting to go, hey, I'll just join the bundle plan and get the better rates. But now insurances are changing the game a little bit, and they're stacking the networks and kind of picking the lowest in the stack. So you don't want to extend yourself and be in more than one bundled plan is my recommendation. You want to pick one. And the difference is, Maria, that you mentioned, that there are differences. If you look at the listing of plans that are underneath of Carrington, it's a little bit different than the Dentamax list or the Zealous list. And so you may want to look at, hey, this market, I need the Humana and I need whatever. So you want to be aware of that listing, which they should share with you when you're having your discussions and negotiations, or any good, third party like myself would have a listing for you, so who is all in that bundled network. But those bundled networks are always changing. I mean, I get an update every quarter from all of these carriers and networks saying, we added a new partner. So you're signing up for a plan, and now you're at the end of the year, you're in 5 more plans. So it's just good to be on top of this stuff, if that answers your question.
Yep. It's good information, Chad.
Yeah. So I mean, I just again recommend, pick, if you're going to go the network bundled plan route, pick one, and then if you have other plans you want to join, pick those as well. And you can always one other key element is you can always leave these plans. I mean, you can give 90-day notice typically, and you can leave these plans. So if something doesn't go right, if you're getting all kinds of claims problems, if nothing's coming through the third-party network that you thought it was, I thought Humana was going to come through, but in my market Humana doesn't come through Dentamax or something like that, you can remove these plans and go direct with the payer, or you can just go out of network. So there are options. You're not locked into a 2-year contract. You are, I mentioned earlier, that was a fee renegotiation, not that you have to stay in the plan for 2 years, just again for clarity.
Got it.
Yeah. I could probably spend more time on that topic, just
Yes.
which plans to be in. I mean, it's up to you. I mean, I work with many clients in many offices who are in 30 insurance plans, and they do very well. They're seeing, a patient in the chair is better than no patient in the chair. It's very competitive out there. There's a lot of dentists in certain markets, and you need to be in network. And then there's offices that are, basically fee for service. They take 3 insurances and it works well. So if you can drive and market to those plans, that can really help you as well. So you don't have to join 50 plans to be successful, and you don't have to just pick 1 or 2. You can be anywhere that you feel is good. And you can, I recommend typically for a new office, pick, whatever number you feel good with, let's say 6. See if that drives patients to your door, and then, okay, let's join some more, right? And let's see what we need to do. Because as I mentioned earlier, if 70% of the market has some kind of insurance benefit of some kind, then they're looking for a provider who has that plan, right? They're not going to go on a network. So, and because there's a lot of competition, a lot of dentists markets you should look at. That's another thing you could look at is go on the websites for these payers and search your zip code and see how many dentists come up in the Cigna website and go, oh, wow, there's 50 other dentists in this market that take it within 5 miles. I better take it, or everyone's going to go find a Cigna doctor somewhere else, right? So it's just another thing that I support offices with, and looking at the market as well.
Good to know.
Yeah.
All right.
But it could say, it segues right into the credentialing topic that you got on the screen here too. And I think that once you kind of negotiated, figured out what plans you want to be in, and what which ones are acceptable, you made those decisions. Then it's working with. It's important to, again, you can handle credentialing yourself, and you can outsource that. Again, someone like my company, many companies handle credentialing for offices too, because it's a cumbersome, tedious process, and it's very confusing. And again, ask the payers for all the right forms. It's so important in the beginning to usually work with the person you're negotiating with. They will usually have a good handoff to the credentialing team. So they'll say, hey, great, we got the contract figured out, we got the fees figured out. Now you're going to credential with us, and here's the person you're going to work with, or here's the forms you need to complete. So a lot of times they do a nice handoff in that. So it's important to be working with a person, though. And I mentioned, and you got a nice little video there, the fax machine on fire there. I think it's you want to avoid fax machines just because you fax in the documents and you really don't know, did they get them? No one's responding to me on a fax, right? So it's important to be working with a person, or generic email boxes. I know a lot of them have that, and that can work usually fine. But if it says, credentialing at metlife.com, again, you hope someone will get back to you. And that really is one of the first elements of, and I think the next slide has it maybe here. Yes, following up with the plan. So once you complete all the documents, which again, there can be many documents, there can be a contract, there can be an agreement, there can be an application. They're going to need all of your certificates. They need a copy of your license, your malpractice, your DEA if you have one. So there's a lot of stuff. And again, a good insurance packet will have all of that listed. But also that can be, again, many, many pages of information, and it can be very overwhelming to look at for credentialing. So that's why a lot of people outsource credentialing. It's very cumbersome and tedious. But if you do take on the challenge yourself, these are some key tips to look at. And I look at it in 3 main phases. Is I complete everything and I send it off to the carrier. The number one thing you want to do a day or 2 later is confirm receipt, and go back to that same source and say, hey, did you get my stuff? Because that's a notorious thing that I hear from insurance offices and even insurance companies. Oh, we never got that. And so you want to keep that information. So that's where, again, a fax can be challenging. You can get a fax confirmation, but they can still say I never got it, or we picked it up, or who knows. But an email that you can re-forward or copy and paste and send it to them is going to be a validation that I did send this in. Because the other thing you're doing when you're confirming your receipt is also confirming that they have everything they need, which is an important factor as well. A common credentialing pitfall is, I sent everything in that I thought they needed, and then I find out when I checked in a month later, hey, am I credentialed? Am I in network? And they go, oh, yeah, we never got that agreement. Did you send the agreement addendum? And they're like, oh, no, I didn't know I needed that. And well, that was a new thing we just added a month ago. Okay, well, again, bad information. You're working with insurance companies, large companies. They change things a lot. The forms change a lot. It's good to make sure you have the most current forms and agreements. So that's where that confirming receipt is very important, that they have exactly what they need. They're processing it. They'll usually, again, good insurance companies will follow up with you nicely and let you know you're missing this, or you forgot a box, or you didn't put in your date of birth, or something like that. But that's an important aspect. And then once they confirm receipt, the in process sort of check in, it can take, again, some carriers are really good. It takes 3 weeks for them to do all their credentialing, their background checks and everything. And then some carriers can take 3 months. I won't even talk about how long Medicaid usually takes because that can be much longer. But it's just, it's important to have a check-in point, right? So, and even ask them, how long will this take? Oh, it'll take about 6 weeks. Okay, we'll check in after 4 weeks, whatever. Make sure it's all processing. They can usually give you some kind of update. Yeah, it's all completed through our first pass, and now it's going to committee review or whatever it may be. So it's important to just be checking in with them and having that diligence, that follow-up. You don't want to get caught later again and have to start over, because that'll happen if you missed something, like I said earlier, or you forgot to put an agreement in. Basically, your clock hasn't started. And so you have to then send everything in a complete packet. Otherwise, they don't start the process. And some carriers don't do a great job of follow-up. So they may get a packet, it's incomplete, and they don't do anything with it. And the good carriers will follow up and say, hey, you missed this. But it's just important to make sure you're in process. And then following up towards that timeline. If they said 4 weeks or 8 weeks, making sure you're following up to go, hey, am I now in network? What is my effective date that I want to document that effective date too, because if they say, hey, you're effective September 1st, for example, you need to know that. So if your claims come back on September 8th that are out of network, you can say, wait a minute, I was in network on September 1st. Why are these claims on September 8th out of network? And you're telling your patients that you're in network at the correct time. So it's important to keep track of those effective dates with each plan.
Hey, Chad, I got a question from a Dr. Danny. He's currently an associate as well as opening up his own office. And he'd like to know, can't he just add a location?
So it's a great question. Yeah. So if you're already, so this is the in-network, or this is the process, credentialing process. If you're joining a plan for the first time, it can take 3 weeks to 3 months. If I'm already in network with Cigna, for example, and I'm creating my own office or moving to another location, another group, another practice, whatever, it's a shorter period of time because the insurance company does have you in their system. So you're in the system, you're credentialed, as long as you're within their credentialing and re-credentialing guidelines, within typically 3 years. If you haven't, done a re-credentialing, you're good. And so the add location process usually takes 30 days or less. The worst carriers take 30 days. Some of them take 2 weeks just to add a new location. Now, again, if this is a completely new location, because you're opening a new office, there will be more hoops to jump through. There'll be a contract, there'll be a new office form. If the office already exists, if you're joining a new group, or if you're joining some other scenario that's already in the payer system, again, it's much quicker. But for a completely new office, like we're trying to focus on the de novos, it could take a little longer. You're in the system, you don't have to do full credentialing. It's a great question, but you will have to do an add location. Maybe send your malpractice. With some carriers need that, and maybe an office form of some kind as well. So that is important.
Thank you.
So that is a good thing. And again, I'm working with the same one I referenced earlier in North Carolina, where she's coming from a group. They're in network with 8 plans. She wants to join the same 8 plans. We're looking at other options too, but it'll help for those plans that she's already in network with. We'll get in network quicker once we get that rolling and she opens up the office. So that's a good thing. But if you're joining some plans for the first time, prepare to be a month to 3 months.
Wow, that is a long time.
Yeah, it is.
My inner millennial just has to come out really quickly when you guys are talking about fax machines. I'm saying, like, I've never owned a fax machine, never even really seen one, wouldn't be able to tell you how to send one. So any doctors out there that don't know how to do it, okay, I don't either.
That's not that, it's very timely. I just had an email discussion with a carrier. I don't, it was Blue Cross of Alabama, I'll say it. And they said, oh, I sent in the credentialing forms for a provider I'm supporting. And they said, nope, you got to fax those in. And I said, wait, what year is this? And I literally said that on an email. And I said, are you're serious? And so they said, yep, we got to fax those in. And I go, okay, I'll do that. But I said, you do realize that we have email. We're actually emailing right now. You and I we were emailing, and they said, oh, you got to fax in the forms. And I was like, very antiquated process, right? So I gave him my 2 cents about it, and I understood that the person I'm talking to isn't the policymaker. I get it, and I told her that. But the point being, we need to modernize this stuff because these paper forms and non-electronic signatures and things like that are very old school. I'm with you, Nicole. I'm much older than you, but I agree.
if someone asked me to fax something, I'd be like, well, it looks like I'm out of this game because I don't own one. I don't even know where to go to find one. So looks like I'm just gonna bow out respectfully.
Right.
I
And
can't scan it.
there are basically email to fax services. I have one for my company, and that we can basically, so I can fax stuff in, but I do it over email, and it creates a fax for them. So it's you have to use a third party to help you because I don't have a fax machine either.
Well, I know if I ever need something faxed, I know where I'm coming. I'm coming to you, whether it is for credentialing or not. I'm just coming to you to fax something for me.
There you go. That's true. Yeah, for sure. How are we doing on time here, by the way? I didn't know how much.
I think we're doing great. I mean, if we just want to kind of touch on some of the takeaways and we can wrap up. Wow, you are very impressive on timing.
Are we right on track here? Good. So these are great takeaways here too. That we touched on some of these things here, but to start the credentialing again, 90 days is a good timeline. You may be joining plans you're already in, so you may not need the 90 days, but it's good to have that time for negotiating. So you want to be able to do that. The sooner the better. Again, came across an office that they don't have their new phone number yet, so it's hard to get the office set up without a phone number, right? So you could run into roadblocks where you just don't have all the information you need to set up the office. But once you're ready to roll, that is important. Again, and at that same point, you're looking at plans, negotiate with those plans. At the same time, you want to start that credentialing. So you're getting that going. You're in the plans you want to be in. And I've seen strategies where you just said, hey, you can also just pull the credentialing. You say, hey, I'm negotiating fees, but I want to get the paperwork going. And then we came back and we couldn't negotiate very good fees. So we said, hey, sorry, pull that application. We're not going to join. And that's another option too, is you can get the paperwork going and then finalize your fees and then kind of tie them together at the end as well. But that gets a little trickier to do on your own. And then, just a key element again that we touched on earlier with the in-network plans, having those fee schedules in your system is important because it does tie to what you're charging patients and what you're expecting to get reimbursed. So as a PPO office, you want to really be focused on those fee schedules that you have and keeping copies of those and loading them in your software as well. That's a good tip.
Yeah. Hey, Chad, I've got a question from a Dr. Susan. What are the challenges with the payers to look out for?
Oh yeah. Well, how long do we have?
That's another series.
Well, yeah. So I think there's a lot of ways we could go with that, and I think the first thing I think of with the challenges with the payers is just, again, if you're negotiating on your own, it's important to be very diligent, and sometimes they'll sort of rob Peter to pay Paul. And you may say, hey, this schedule is pretty good, but I want to raise these other 10 codes. And they go, oh, great, we'll raise those 10 codes. But they don't tell you that they lowered 10 other codes. So it's important to be diligent about looking at the fees and when you're negotiating, not assuming that I asked for 10 codes to increase, that they didn't do anything else. So it's important to look at those side by side every time. So that's a good challenge you should be, looking for. I think, just the other pitfall, it just being diligent, being that squeaky wheel, I think is so important, whether it's credentialing or negotiating, because again, it behooves them to keep your fees as low as possible, right? So you've got to be diligent and on them regularly without being too annoying to stay, with them and negotiate. Give me that fee schedule. We need to get this done. I'm opening my office, and just staying on top of it, because again, they'll slow play it. That's a classic negotiation tactic, is to slow play it because they know you're in a hurry. And you'll end up just agreeing to something that you don't really want to accept. So those are a couple of big challenges you should look out for.
So it definitely sounds like they need to do this even well before the 90 days. Just have number one, have that vision. Number two, and make the decision whether you're going to be taking plans, if you're going to be in network or not.
Yeah, and then which plans, right? And again, 90 days is I would say that's your minimum number. And if you can have more, that's great, because then it doesn't put you in a bad place when negotiating. And don't accept the first offer. There's another negotiation tip, right? Unless they say they'll pay your full fee or something, but that doesn't happen. But I think it's just important to just be careful and looking at all the stuff and thinking of their side. They want to keep your fees low to help their members and help their bottom line, and you want to get your fees as high as possible, as close to your full fee. So just be aware of that. And then, we touched on a few of these other points too. Review and update your UCRs. It's just important to do that preliminary analysis for your new office, and then do it again in a year and look at the market and just determine if you need to raise your fees and how much. you should raise your fees, and to keep up with, at least we keep up with your costs, because your lab costs will go up annually, your salaries and benefits will go up yearly. And if you're a PPO provider, you can only get reimbursed up to those fees, right? So if your rates don't change from the carriers, and you need to raise your UCRs for those patients, but then you want to share those with your carrier so you can go and negotiate again on an annual or every 2-year basis. And so you want to raise your rates on an annual basis to show the carriers, I'm raising my rates with the cost of doing business. Hey, carrier, you need to raise your rates, because that's one thing that I hear from carriers sometimes too, is they'll say, well, the office hasn't raised their rates in 5 years, but they want us to pay them more. What's the deal? So you just don't let, it's good to just keep up for your fee for service patients, but also it helps you with your negotiations. And most people don't realize that aspect as well. And again, we've been touching on this about using assistants, and again, it doesn't just mean my own assistants or a vendor like myself, but attend conferences, webinars, join groups like this. This is a great, CareStack's doing a great thing here with these videos and these knowledge sessions. Ask Facebook groups and different groups in the industry to help you. Who's the best at this, or what's your advice on plans to joining this? I've heard in many blogs and things talk about that. So if you have the time, try to do those things to help you as well, because you need help with this. And if you don't have a good front office to have that has time to do this, get help from a third party. It can really benefit you as well. Those are some of the key, I would say, takeaways I have on it.
Yeah, of course. And we can definitely share those with anyone. Please reach out to us if you do want us to send over that slide deck or that specific slide, get those over to you guys. But thank you, Maria and Chad, so much for being here this evening. We really appreciate it. For anyone that wants to get in touch with Chad or Maria, you can find their contact information on this screen. We will also be sending this out to everyone who joined today. We thank everyone for joining, whether it's the evening, or I guess it's probably still afternoon for some people all the way in the Pacific Coast, or if you're lucky enough to be in Hawaii. Good for you guys, you go. But I hope everyone has a great evening, and thank you guys so much.
Thank you.
Happy to be here, Nicole. And if anyone just has a general question, you feel free to email me. No problem.
Yeah, thank you, Chad. You're
Thanks,
a wealth
Nicole.
of knowledge, and I gotta tell you, I've worked with you as well, and you've done a great job negotiating fees for several of the groups that I work with. So you know your stuff. Thank you.
Happy to help.
Yep.
Happy to help and share my knowledge. But yeah, thanks again, Maria and Nicole, and everyone listening. Appreciate it.
Thanks, everyone. Have a great evening.
Have a great evening.
You
Thank
too.
you.